Welcome everyone, and I'm really grateful for all of you to join us so early today on a rainy, cold day. When I came to Geneva earlier this week, over the weekend, it was so bright and sunny and it made me so happy. What seemed to be a very promising week weather-wise, soon, I think I jinxed it. But nonetheless, we are here and I'm really grateful for all of you to make it so early. And welcome to our launch of the Break the Fossil Influence campaign. My name is Shweta Narayan. I am the campaign lead at Global Climate and Health Alliance. Many of you would have been receiving several emails from me. So again, thank you for that. Let me start today's events, and thank you for all the colleagues who are online watching us, and I apologize for a slight delay that in the beginning of the session. Must be curious, what is this Break the Fossil Influence? As climate and health advocates, we know that fossil fuels are the root cause of the climate crisis. They are main contributors or major contributors to air pollution, and also the primary driver of the climate crisis that we are seeing around us. Fossil fuels are making us sick. Plain, simple fact. Next slide, please. Oh, I don't have the clicker. And people who are living on the fence lines, people who are most vulnerable and marginalized, are paying the price of fossil fuel, the fossil economy, with their health, with their future. This is a fact. However, many people, or let's put it this way. However, fossil fuel industries are paying millions to PR and advertisement agencies to spread disinformation, to deny that they have that they are affecting people's health and causing the crisis, and delay the urgent action that is needed in challenging and stopping or mitigating the climate crisis. And that's also a fact. As people who have shared interest in the environment and the future of the planet, and as our responsibility to our health, to our children's health, we need that information today, true facts, correct information today. However, fossil fuel industries are paying millions to the PR agencies and making them complicit in spreading this disinformation. I'll show you some examples, and we have a panelist today who will go deeper with the research that he has about this complicity. But just to give you an example, how direct this conflict of interest is. And this is research done by colleagues at the Clean Creatives, a very big PR company, Publicis, that works and has won several awards for its progressive cancer awareness campaign, but also at the same time holds portfolio of fossil fuel industries and, as I said, greenwashing them. And there's plenty of evidence to show that fossil fuel industry is also causing cancers. So that's one example. Another example close to home, with another big PR agency, Edelman, who partner with health industry in portraying them as climate leaders for all the good work, but at the same time are also partnering with fossil fuel industries in promoting the use of fossil fuels, which we know will have severe health consequences. This conflict of interest is important to recognize and important to challenge. And why should the health industry challenge them? We have, in the last 6 months of our research that we have been doing around this subject, we realized that, and after speaking to a lot of colleagues at the PR and ad industry, we realized that the PR industries derive a lot of legitimacy with their association with the health industry. And sure, I mean, the health community is doing a fabulous job of, I mean, their mission is to save lives. So associating with the health industry gives them that positive reinforcement and that credibility. So they are, in a way, by extension, exploiting the goodwill and the trust and the credibility that the health community has to sell themselves as leaders while they're spreading disinformation. And this is a conflict that we really need to call out. And this is the space where health industry needs to assert its power and its hold in this space to call out and help PR industries understand this conflict and help them make the right decision and not spread disinformation on behalf of the fossil fuel industry. And that's the campaign. This campaign called Break the Fossil Influence is a campaign for a fossil-free health communications and a commitment by health organizations to look at their procurement practices of communications and PR agencies so that they can screen them for this conflict and ensure that they engage with fossil-free health communication. The commitments are pretty clear and pretty straightforward and very, very necessary and urgent. Challenging disinformation, and we'll hear today from our panel how critical disinformation is to challenge, adhering to better practices in screening and leading by example is the crux of this commitment. And I really, really sincerely applaud the leadership of the 30 health organizations today with us who have signed this commitment, who have already decided to clean up and engage in fossil-free communications practice. And here's the list of the 30 organizations, but we hope that this is the beginning. And again, we are very, very humbled and proud by the leadership shown by these 30 organizations. One thing we do realize is that it's very easy to make a commitment. Then how do you implement that commitment? And in order to do that, we have put together a guidance document which will help you. So, okay, I want to have my communications practices fossil-free. How do I screen the PR agencies if I want to engage with them? So this guidance helps you get to those 3 questions that you really need to ask. These are very basic 3 questions, and it'll help you decide how you want to proceed with when you get the responses from the PR agencies. So with that, I would like to hand over to Dr. Jenny Miller, Executive Director of Global Climate and Health Alliance. Before that, sorry, clearly I'm all over the place today morning. Before I hand over to Dr. Jenny Miller, there is a short video of some of the health leaders who have signed this commitment but could not be here today. So can we have the video, please?
Fossil fuels are making people sick, and ad and PR agencies are helping polluters hide the truth using the same playbook they had for big tobacco.
Fossil fuels pollute our air and water, contribute to the climate crisis, and endanger life.
As health professionals, we're trained to protect life, not partner with those who endanger it.
That's why we're joining the Break the Fossil Influence campaign.
To demand fossil-free health communications, we're calling on every health organization.
Don't work with public relation or advertisement firms that also work for the fossil fuel industry.
It's another step to align our communications with our mission to improve the health of the peoples of the world.
Just like we stood up to big tobacco, now it's the time to step up to the fossil fuel industry.
And by so doing, we will force them to make the right choice. And the right choice is the choice for health and for healthy communities.
Let's break the fossil influence because health comes first.
reiterating Shweta's appreciation for all of you being here today. And I'm excited to bring on a panel that we're going to hear from, where we can go into more depth on this issue. Today's panel brings together experts from health, policy, communications, and watchdog organizations to explore how disinformation, greenwashing, and industry influence are shaping the health narrative, and how we as health and communications professionals can respond with clarity, conscience, and courage. So we're meeting at a time when disinformation has been identified by the World Economic Forum as one of the most pressing global threats. And I think all of us have seen this around us in the health space and in many other spaces. The fossil fuel industry, much like big tobacco before it, has long used PR and advertising to mislead the public, delay regulation, preserve profits, delay action on climate change, and all of that at the expense of health, equity, and the planet. Today's panel will examine these challenges, spotlight solutions, and explore the moral leadership that we bring as the health community and that's needed to rebuild public trust and assert health to be at the center of climate action, not fossil fuel industry profits. So with that, I'd like to invite our distinguished panel to come up and join me on stage. Vivek Parekh is a researcher at InfluenceMap, which tracks the political influence of polluting industries. Come on up. Dr. Jamila Mahmood is the executive director of the Sunway Center for Planetary Health and a global humanitarian leader. We also have with us Dr. Viviana Martinez Bianchi, who is the president-elect of WONCA, the World Family Doctors Organization, representing family doctors and primary care providers across the world. We have with us as well Mirhana Arlaud, founder of Future by Design, which are working at the intersection of ethics, creativity, and sustainability. And finally, we have Dr. Diarmuid Campbell-Landrum, who is head of the Climate Change and Health Unit at the WHO, and whose leadership on WHO's leadership on commercial determinants of health has shaped global policy. So delighted to have all of you with us here today. I think this is going to be an interesting set of perspectives on this issue. And I'd like to start off by handing over to Vivek to walk us through what the data shows about how fossil fuel companies are using PR and advertising to delay action on climate and health. Do you want to be up here, or yeah, and you can have
Thank you very much. It's great to be here, and thanks for having me. For some background, InfluenceMap is where I work, and I am a fossil fuels program manager. And for anyone that's not aware, InfluenceMap is an independent climate risk think tank. We were formed in 2015 on the eve of the Paris Agreement, and we are headquartered in London, but we have offices globally. We have two main work streams, the first of which is LobbyMap, and as part of this, we track and analyze how the corporate sector is influencing climate policy globally. We work with a range of stakeholders, including investors, think tanks, civil society organizations, as well as policymakers and also industry. LobbyMap is a database of over 1,000 companies and 300 industry associations by which we look at how they engage specifically with climate policies around the world. And as part of this, we want to specifically look at the broad nature of influencing. So this goes all the way from direct lobbying activities to how the advertising and PR industry play a role and how they use social media and also investor communications. We differ from some of these other think tanks as shown here, as they often focus on, do great work looking at operations and metrics, whereas we are more interested looking into regulatory behavior and lobbying activities. So why is this idea of climate policy engagement and advocacy important? Well, the Intergovernmental Panel on Climate Change in 2022 stated that opposition from status quo interests exerting political influence over the policymaking process as a key major reason for slow progress on climate policy. They highlighted that major greenhouse gas emitting sectors, such as the fossil fuel industry, were key advocates behind this. And as these headlines indicate, the fossil fuel industry dominates the lobbying landscape. Our data also backs us up, as you can see the blue and green dots on the left-hand side showcasing that the majority of companies advocating with positions misaligned with science fall from the fossil fuel industry. What we see is that the fossil fuel industry attempt to weaken and obstruct climate policy despite clear economic health and climate benefits. So we know they're at COP, the fossil fuel industry, and their major blockages. So let's deep dive into an example of how they do this. Well, our 2022 report looked at the International Gas Union, self-proclaimed spokesperson of the gas industry, representing over 90% of the value chain. We accessed internal documents online to identify their strategy to defend and enhance the role of fossil gas. They explicitly stated that climate change is an existential threat to the fossil gas value chain, not the other way around. They also stated that a legislative tsunami would really be a significant barrier and challenge to the promotion of gas as a solution. And what we identified was a deliberate playbook that had strategic aims to lock in the role of fossil gas. So how did they do this? Well, their playbook was all around the idea of creating social acceptance and a social license for fossil gas. It involved three main areas: a communication strategy, whereby they developed regionally nuanced and specific narratives aimed at different audiences. So, for example, in the global north, they focus on the idea of greening gas, around creating gas as a climate solution using different terminology such as low carbon gas, renewable gas, whereas in the global south, they promoted gas as an idea of economic development, societal development, and sustainable development, tackling issues such as energy poverty and clean air. They also highlighted key advocacy targets and institutions in which they wanted to raise their credibility and influence decision makers. As part of this, they had three main objectives: dispel any concerns around the role of gas, disrupt climate policy agenda, and defend the role of fossil gas against any climate policy. To go into a little bit more detail of how this looks, influencing is rather broad, and it's not just specific to direct lobbying. So to run through an example of this, we recently released a report looking at building electrification policy this year. What we wanted to understand is how buildings policy that would lead to significant economic, health, and climate benefits was being particularly pushed back from the fossil fuel industry. And there were three main stages of this playbook. The first was to shape public discourse, so the use of advertising and narratives to promote significant negative impacts from the idea of decarbonization. So these ideas often tied to specific public narratives. So they would be tying electrification policy to high energy prices, or the idea that they're restricting freedoms and consumer choice. The second was to set the policy agenda. This involved using campaigns and front groups, often with benign and broad-sounding names such as Rural Futures or New Yorkers for Affordable Energy, that would suggest a grassroots movement, when in fact these were funded by the fossil fuel industry, aiming to reinforce those same narratives that they pushed in the public domain. The third part of this was to engage with policy. So this was through direct meetings with officials, through detailed policy consultations, and through legal action that often questioned the legitimacy and the authority of rulemaking bodies. So what role does the advertising and PR industry play in this? Well, the UN chief, Antonio Guterres, labeled the advertising industry as the godfathers of climate chaos only last year. And what we see is that the advertising and PR industry really reinforce narratives to promote them in the public domain and then push them towards policymakers. So to give some example of this, in the US, we've seen specific narratives around restrictions on freedoms and consumer choice promoted for different campaigns. So this has been used for the tobacco control, this has been used for gun reform, and now we're seeing it used for anti-electrification policy. So both of these examples from the bottom, you have the American Gas Association with the Don't Ban My Gas Stove, and also the Hands Off My Stove campaign, really reinforce this idea. Another key tactic that we see is muddying the waters. DSMOG did a really interesting article a couple of years back that identified that the American Gas Association had been deliberately discrediting research despite knowing the significant negative health impacts of gas stoves on air pollution. What we see is that they continue to do this and discredit research to this day, despite the clear and growing consensus around the impact of gas stoves. Alongside these tactics, often industry will pressurize academics and continue to publish research to try and discredit this growing academic concern around the use of fossil gas. We also did a report last year that specifically focused on the advertising and PR industry. And what we saw was significant potential conflicts of interest from companies representing clients with opposing climate advocacy. For an example, the American Petroleum Institute is said to spend a third of its entire budget, totaling at least $50 to $100 million on advertising and PR. Fossil fuel advertising impact the healthcare sector the same way as tobacco advertising. The World Health Organization estimates that climate change will lead to an additional 250,000 deaths per year between 2030 and 2050. Therefore, locking in fossil fuels through advertising, PR, and lobbying is directly contributing to this loss of life, while these companies continue to take funding from healthcare and other key sectors that are trying to improve societal benefits. Therefore, by working with the healthcare sector and the climate sector, while representing these fossil fuel interests, it's clear that the advertising and PR industry are undermining their representation. Finally, just to highlight some potential successes and where we can move towards. Only this week, we saw that Energy Australia apologized to over 400,000 of its consumers and customers after claiming that carbon offsetting was a significant way to reduce emissions. We also saw in recent years that The Hague became the world's first city to ban fossil fuel advertising. So we know where we can succeed and what success looks like. It's clear first we need to identify how the fossil fuel industry is succeeding, what we can learn from this, and how we can tackle it effectively. Thank you.
Thanks so much, Vivek, for really laying that out for us. And I'll note that you mentioned COP28 and the number of fossil fuel affiliated lobbyists there. We did account, not we, GCHA, but we, the health community, did a count of the number of health representatives at that same COP. And my recollection is that there were about 4 times as many fossil fuel lobbyists as there were health advocates. So we're currently being outgunned a little bit, and there's some work to do here. Okay, next I'd like to turn to Dr. Jamila Mahmood. Dr. Jamila, from your vantage point as a humanitarian and a health leader who has worked in crisis settings and now on planetary health, disinformation is increasingly seen as a threat to planetary health, especially when it comes to climate and public health. How have you seen the effects play out, and what responsibility do health leaders have to push back against misleading narratives, particularly those tied to the fossil fuel industry? And what would happen if we as health institutions stay silent?
Thank you very much, Jenny. And first of all, congratulations to GCHA for really leading the way, helping us as health professionals to learn how to communicate better and get the message across. And to all of you who actually braved the rain to be here, I'm impressed. So on your question, Jenny, I think disinformation basically distorts the reality. And that itself will lead to delayed action, and also it will cost lives. You mentioned about my role as a humanitarian and health worker, but even more recently with the COVID-19 pandemic, we've seen how this information has really changed people's views and created all sorts of fears, vaccine hesitancy, all the challenges that false narratives have led us down this little rabbit hole. And it was really undermining not just science, but also public trust in health professionals, including the likes of Tony Fauci, who's a world-renowned leader on health. And what it does is just paralyzes decision-making, which should be urgent, and also dissuades, politicians, policymakers from making the right decisions. You mentioned correctly that, the World Economic Forum, in its Global Risk Report, consistently mentions disinformation and misinformation as among its top risks. And it's in line on the same level of risk as geopolitical conflicts and extreme weather events. So I think that for us in the planetary health world, this is an existential risk. And I think that, denying the harms of fossil fuels is really going to harm people, the downplaying of climate-related diseases. I think that for me as a medical professional, but also someone who's worked in the most difficult settings, it's really about the people we're trying to help and the people who are not really seen by the public and by the masses around the world. And I think that what we need to do is take a very strong stand as health professionals and health leadership that we can't be neutral. We have to take a very firm stand that it is our moral imperative, and it is also our Hippocratic oath to do no harm. And to do no harm really goes beyond just treating disease, but also preventing it. And I think the confrontation that must be now had with the fossil fuel industry, the way they've manipulated the truth, we've learned from the tobacco industry. Some of us may be old enough to remember that doctors prefer camels, right, to smoke camel cigarettes, and people in white coats puffing away. I think the same thing, that we've seen also with British Petroleum, saying, all sorts of things like beyond petroleum, really putting the greenwashing effect. So I think just as we rejected tobacco, just as we've had to confront many of the challenges, not just in the tobacco industry, but also, issues around marriage equality, around women's rights and suffrage. These things we need to learn from these movements that have had to confront, big PR manipulations. And I think, data is the gold mine that we need. And I think the work that you do, Vivek, becomes so critical.
Thank you. I'd now like to turn to Dr. Viviana Martinez-Bianchi, who is the president-elect of WONCA. So I'd like to hear from another health professional. This issue hits home for frontline health workers and primary care professionals who are working with and talking with patients every day. Why is addressing fossil fuel disinformation relevant for family doctors and primary health care practitioners globally? And what kind of support do clinicians need to be able to speak out confidently on this issue and confront these challenges?
Thank you for the very good question. I'm going to start with the answer to the first part. Why is it important for family doctors and primary care practitioners and provider clinicians? Well, first is the health harms. We see how air pollution, and I think it was the slide that Shweta showed earlier, how air pollution from fossil fuel contributes to respiratory illnesses, to cardiovascular disease, to cancer, to adverse pregnancy outcomes, premature death. We see, I am a family doctor in North Carolina, and I see how heat is affecting farm workers, for example. The severe effects on people who are working in our fields. We also see the impacts firsthand among vulnerable populations, elderly people who are really, we're seeing the increases in chronic illnesses related to climate change. We also, and then in regards to why is this important, we are trusted voices in the community. And to be informed and to be able to really, really talk to our communities, our patients, to be even ready to respond to questions from television, from different channels is so important. We are among the most trusted professionals worldwide. If trained well, we have voices that can really counteract these information campaigns and public and actually mobilize public understanding and action. As family doctors, we are uniquely positioned to inform, to explain, and to do the importance, to also speak about the importance of health equity implications. Yesterday, I host every Wednesday at noon a special Zoom meeting, a Zoominar, I call them, for people in North Carolina that are Spanish speakers, and we do it with simultaneous interpretation. And it was actually about the effects of climate change on, how it disproportionately affects Latino communities, in particular in North Carolina and in the U.S. But Latino communities there are the marginalized communities, and you will see this everywhere in the world. There is the marginalized community often living in that interstition, we call it a society, most affected and also vital for the economy of that place, but are really affected disproportionately. So we, as family doctors, are advocates for health equity, for better outcomes, and we need to highlight the misinformation campaign, this infodemia that we've been seeing. It's very, very important.
Yeah, and as family doctors, you are really right in the community and seeing people, seeing families, seeing patients all the time. Are there past examples where WONCA or its members in the family doctor community have responded to similar ethical challenges?
Yeah, so WONCA has a really an interest group or a working party on planetary health that has done a lot of information. I personally have felt benefited by our group that is really looking at what is happening, following policy changes, following what's happening, and really informing all of our family medicine community about the implications of these attacks on the health of our planet. We have seen multiple of our member organizations. WONCA is an organization of member organizations representing 134 member organizations in 115 countries, and many of our member organizations are also starting to speak up and establish fossil fuel-free policies. And I also, it's that creation of peer networks of practices, bringing people together to be able to say, to start realizing we are not alone, that we are working on this together. Training family doctors on how to speak to power, how to speak to the public, and also gathering support from public policy experts. In some places, speaking about this can be actually dangerous. And so it's really, really important on realizing how we need to humanize the effects of the fossil fuel industry, and how do we really relate it to the effects on people every day in every country in the world. It really, really informing is key for the work that we're doing.
Yeah, and your point about the particular role that family doctors and healthcare providers can play, both in kind of bringing forward these issues with that kind of evidence base behind it, but also telling the stories of what that real impact is. That's really powerful.
Yeah, and if I may add, I don't know if there are medical students in the room, but one thing that we have seen in prior campaigns, in prior issues, for example, the influence of pharma industry on medical practices, it was medical students who organized and informed and started doing these report cards this university has a report card because they work with less influence from the pharma industry. This university has an F because they fail at really working with the misinformation. So it was very, very important for medical student organizations to really look at using the data that you were sharing earlier to start looking at, okay, what's happening in my university, in my school of medicine. They have an A plus, or they have an F, or they have a C or a D, and I started seeing how it was affecting. It's like, oh my God, we just got a C. We need to work better at improving how we're doing this. And so I think it's another campaign that I've seen work really, really well in the past.
Yeah, it sounds like there's a cohort of med students that Influence Map should consider hiring and bringing on board. Okay, now I'd like to turn to Mirjana Arlaud, who is with Future by Design from the creative industry. So Mirjana, many creative agencies continue, as we heard, continue to work for fossil fuel companies while publicly supporting sustainability goals. From your experience, how do they justify this contradiction? And what does it reveal about the kind of ethical challenges facing the creative industry today? We get a lot of sort of very creative, brilliant, talented people going into that field. What are those, how are they dealing with those ethical challenges? How do they justify that contradiction?
Great, thank you so much. Perhaps I should just give a bit of background where I come from. So I used to work for the UN for nearly 10 years, and we were working on introducing sustainability and sustainable production and procurement practices in the global health sector before sustainability was a mainstream thing and sustainable development goals were not adopted even at that time. And having worked with the UN agencies, the governments, civil society, academia, etc., the private sector as well, we really raised millions of dollars. We established thousands of partnerships, but really telling the story of the impact on the ground was something that I really much appreciated, and I've seen that it's something that we have to focus on much more. So I have always been driven by the sustainability and just the impact that we can have bettering our health and the health of our families and also for our planet. So having had that experience, I decided to take a step outside of the UN system and establish Future by Design. So we are an award-winning creative agencies and comms agency, and we are present in Serbia, Paris, Cape Town, and Istanbul. And for the past several years, we have been collaborating on fantastic flagship campaigns with the World Health Organization, with UNICEF, with UNFPA, UNAIDS, and across the nonprofit sector as well, to help them tell their story. And it is true, what you said, is that it's really evident that still there are many creative communications, PR agencies that are collaborating with the fossil fuel industry. And of course, I cannot speak on their behalf, but I can speak from my perspective, maybe what is happening. First of all, we're talking about the private sector. So finances are always the main reason why they bring up, and simply say that while they might have a department or a unit or a strategy to contribute to sustainable development goals, in the end of the day, they might have tens of thousands of employees around the world, and it's a big machine to keep on going. And I believe that they justify towards their employees and their shareholders simply as a kind of a significant amount of money that is being given, and they feel it's fine if at the same time they also work on sustainability-related projects. At Future by Design, we're working on projects related to public health and social justice, climate action, more sustainable supply chains, and women empowerment and gender equality. And what we are seeing is that across different sectors, across different industries, working on sustainability-related projects for the PR agencies come as a jail-free card, because it feels that you're justifying financially the betterment and the maintenance of your own company, and it cannot just break even. It needs to be profitable in order to further grow. So I think that they just feel that perhaps it's their balance, kind of, if they focus on at the same time on sustainability, that it helps. And I think also for us at Future by Design, from the very beginning of establishing it, we had, we had very, very clear core values that we believed in. It was to support and through our creative and communications work really advance the adoption of sustainable development, to focus on women empowerment and diversity. And I think by having really strong core values, for us, it has always been very easy to select organizations we would like to work with, to work for, to partner with. And we have never had a situation where the client on the other side would shape our values for us. And I think if an agency perhaps has not been established with a clear ethical core value, then that it's kind of a gray area, and it's not probably seen as an issue for them. And that's why I really, really welcome your initiative and really thank you, because it also gives more space to all the agencies that are fully driven by working on sustainability comms to continue and double down in our work.
And I assume by the fact that you're here that you are breaking even. You are making enough of a profit to stay alive, yes?
Yes.
Okay. Well, and that, that brings up, we've been talking about the moral power of the health community, the ethical power of the health community, the storytelling power of the health community. But the health community also has economic power. And I think that's part of what we can bring to bear here as well. Just a second question for you. In the context of climate and planetary health crisis, what role, and you already spoke to this a bit, what role can designers and communicators play in advancing truth-telling? And again, you responded a bit to this already, but what does responsible health-centered advertising actually look like in practice?
So I would refer to a recent event we organized at the end of April in Paris. In Grand Palais, there is one of the largest conferences in the world focusing on climate solutions, which brought together around 40,000 people. And as part of this conference at Future by Design, we organized a high-level panel discussion on the power of communications in advancing circularity specifically. We really wanted also to push forward not only on sustainability, but also to talk about the whole circular economy. And I think we live at a very interesting times, especially with the Generation Z and Alpha who are coming in and are really requesting radical transparency. And what was very interesting is that at the beginning, I believe that a lot of communications campaigns were related to goals and visions for 2030, 2050, and I think it doesn't really make the cut anymore. I think that the current generations are really requesting what is happening right now, and they really want transparency on the progress, and they want really clear information. And I think when it comes to the nexus of climate and health and a lot of scientific data that is available, the role of creatives and communicators is really essential in making sure that this complex information is delivered in a way that it's understandable for people. I think many times when we do research and surveys, we realize that people still might not have the available information, might not connect the dots between different informations and messages we're trying to deliver. So I would say that our role is definitely in this. So it's transparency about the impact. People need to be aware of the opportunities, the benefits, and the challenges of different products they might buy, different services they might procure, or just relate to the challenges that we're trying to bring kind of closer to them. And something we always focus on at Future by Design is human-centered storytelling. I believe that we always put people first, and having this positive human-centered approach really helps people, because we are talking about ourselves. No one is perfect. We all have our daily lives, professional, personal. At the end of the day, when you scroll to your social media, you're very overwhelmed with everything that you heard, you worked on. And so the message that needs to cut through needs to make sure that maybe we're reaching the audience that is already fatigued, that is already tired. And I think at the beginning of sustainability communications or talking about climate and health, we were focusing more on fear and guilt trap. And I think it just does not, again, make the cut anymore. It really needs to be forward-looking. It needs to be positive, focusing on the opportunities and kind of the solutions and just the benefits of working on this. And again, coming back to communicators and creatives, we really see responsibility in using our skills to advance the understanding around the impact of the fossil fuel industry or the climate impact on people's health. And so we are really grateful to always work with impactful and inspiring organizations who, through their mandate and their work, they advance the work on this.
Fantastic, thank you. And I know in the health community, we look forward to working with creative agencies that have that sort of shared set of values. So thank you for all of that. Okay, turning to Dr. Diarmid Campbell-Landrum. Diarmid, so WHO has a lot of experience working on other harmful, health-harming products, other commercial determinants of health. What are the reputational and ethical risks for health institutions that continue partnerships with PR or ad agencies linked to fossil fuel interests? And how can health leaders protect public trust in this context? You know, we're facing our own set of disinformation and misinformation challenges with the public. How do we rebuild that trust? How do we protect the trust that we do have from that kind of influence of being associated with fossil fuels?
Yeah, thanks, Jenny, and thanks for the invitation. It really has been a fascinating set of contributions so far. I've already learned an awful lot. I think in sort of positioning ourselves as health professionals, health institutions, and so on, and yeah, playing the role that we should play, I think we need to, and avoiding that sort of reputational risk or damage. I would say that on this issue, I would say the health community has already done very, very well. And the reason, the messaging and the coherence that we have on climate change and on fossil fuel influence, I would say has been very well maintained across the UN agencies, frontline healthcare workers, grassroots organizations, and so on, because I would say we have certain reference points. The first of those is the evidence. We're an evidence-based profession, and it is very clear that fossil fuels are immensely damaging to health through the impacts on air pollution and the existential risk of climate change. So you don't see too many health organizations or professionals trying to make the counter-argument, because these are smart people who can read a temperature graph, who understand where the problem is coming from, and have a professional ethic. So that's why that this profession, I think, is so important in this debate. And I would say and willing to stick our necks out, because as a UN organization, we're as WHO, we're a member state organization that includes every country in the world, including the many economies which are heavily dependent. Effectively, their economies are mainly driven by fossil fuels, and yet we are still quite clear from the WHO point of view that we are behind a rapid transition away from fossil fuels. We are the only UN organization to have signed up to the Fossil Fuel Non-Proliferation Treaty, and like our fuels for all of the reasons that we say. So we have that. And that, again, product whatsoever. To maintain the level of tobacco consumption we still have are being explicitly applied to the maintenance of fossil fuels. And it's in many ways, in fact, sort of counterintuitively, those industries have actually been more evidence-based than the health community or the climate community, where we have tended to speak as epidemiologists or talked as climate scientists, trying to throw data at people, whereas those opposing action on these issues have worked as communication scientists and realized that in order to hold up progress on this issue, you don't do new scientific studies, you sow doubt. And you talk to people about things that they fear. So we have to understand what the fight we're in, if you like, in order to address these issues. So I think we have to learn from that. And in that struggle, I think we have to recognize the things that we have on our side. So we have the evidence, we have the trust of the community, the most trusted professionals in the world. Scientists get just beaten out by doctors who just get beaten out by nurses. So all of those things are in our favor. And then what we have going against us are the evidence-based approach of those who are opposing action, which I've just described, and a massive amount of money. Because these are some of the richest companies in the world. They're not rich because they're profitable in themselves. In fact, they're rich because they're massively subsidized. And they're mainly subsidized by a certain amount of direct financial subsidy and then a much greater subsidy, which is the damage on our health. The profits of the fossil fuel industry in recent decades are lower than the subsidies they've received in cash and in kind. But they have that money, and they're able to use that money in order to oppose action. So we have to recognise, what we're up against. I would say that then that the final point I wanted to make on this is to recognise that the messaging and the approaches that we use to address, to push for a rapid and just transition, a healthy transition away from fossil fuels, probably do have to be slightly different to the ones that we used against tobacco. And the reason I say this is because to a greater or lesser extent, we are all somewhat compromised. The economies still run to a great extent on fossil fuels. They play an important part in our daily lives. They are still heavily embedded in health systems. So we can't quite take the same black and white approach that we were able to take and are able to take against tobacco. And I think I was just hearing the importance of telling storytelling in the health community, storytelling. It's not something I'm great at. I'm a UN bureaucrat. I'm British. We don't emote. But I will tell one story about this because it's a family story. And when I think back about the transition that we need away from fossil fuels, so my father left school at 16. He was a working class family on the south coast of the UK, joined the Merchant Navy. So his job ended up being the foreman in charge of stoking the boilers on Shell oil tankers with coal. I mean, that is about as fossil fuel embedded as you can get.
Wow.
And yet, during the course of his career, he ended up, at the end of his career, teaching renewable energy technologies in a university in the UK. And then I do what I do. So we have effectively been able to make a just transition away from fossil fuels
in your family,
in our family history. And we need to, I think, recognise that we need to take populations along with us, because you can't end up with a situation where you have, even if it's doctors and nurses, most trusted people in the world, sounding like they're holier than thou, telling people that we have to cut fossil fuels out tomorrow, and that's the way to do it. We have to recognise this has to be a just transition. There will be difficulties in making that transition. There are costs to making that transition, but to shift back onto the positive at the end, the benefits absolutely massively outweigh the costs. And as health advocates, we're behind the positive story of a healthier, more sustainable future for humanity. And you mentioned, just to bring it back to your question at the end, which I mainly ignored, but about the reputational risks of not doing that. But I have to say, I'll come back to the point I made at the beginning. I'm pretty proud of the health profession on this. I don't see that many people in our profession, our community, running that reputational risk, because the overwhelming body of evidence of our community is behind this transition.
Yeah, thank you. And so this initiative isn't really about kind of reining in reputational risk, but rather taking our influence to the next level. Are there any other kinds of lessons that you'd like to draw out from kind of those other fights around tobacco, around other commercial determinants of health? We've been talking a bit about what professional associations and individual doctors and nurses and healthcare professionals can do, and humanitarian organizations and creatives. What about public health agencies? What's the role of public health agencies in this effort around disinformation and the greenwashing that the fossil fuel industry does?
Just very quickly on that, I think the messaging that we have, or the intent to do it, is very, very good. What I think we're mainly maybe lacking on is the tactics and the mechanisms to get our message out there very quickly. I've been on this issue for quite a long time, and I remember you'd see something published in the Wall Street Journal which was completely, I would say, misrepresenting the story on climate change and health. I would then see an email chain amongst my academic colleagues starting to put together a letter that would take probably a month to get everybody to agree on, to then send in to maybe get published in the Wall Street Journal. That's not how it should work. I think we have to be basically primed and ready with effective advocates to make this case, which, as I'll come back to it again, needs to be proportionate and nuanced, because that is the truth of the story. And I think that's what probably, and here I look to communication scientists, that is probably what will take more people with us, if we appreciate that, that people have a daily life, they have cost of living, they're not going to drop the rest of their life in order to go green immediately. So we have to recognize that. But I think we need to be better on the tactics, if you like, more than we are on the strategy.
I want to come back to Dr. Mahmood, who would like to respond to that or weigh in around that. And then after this, I'm going to go to each of you and ask for a 1-minute, lightning round closing thought.
So I just want to be a bit of a troublemaker, damn it. I think it really depends on where you come from and the context and the culture. I come from Malaysia, I come from Asia. I come from a country that was able to turn around its development because of the fossil fuel industry. So the fossil fuel industry is the darling of the Malaysian public, right? The advertisements that they make for Idul Fitri or Chinese New Year, or indeed our Independence Day, are tear-jerking, emotive. Everybody plays them on. So it's really a cultural thing, and I think that safe and just transition that you mentioned is going to be critical. But we're missing a couple of things. Number one, health professionals are not trained to communicate or to even understand the impact. We are in an echo chamber here. We all are health professionals or professionals that are very sensitive to the impact of fossil fuel damage on health. But it's not out there in so many ways, because even friends who are doctors, our friends of ours who are doctors, are writing to my husband and saying, your wife is such a zealot, but I don't even believe in microplastics being a problem in health. So this is 2025, and I have to deal with this kind of stuff, right? So I think primarily, if we're even going to begin tackling the PR, it's so urgent that we need to somehow build communication into our medical curriculum. We need to train health professionals. And you mentioned about the Gen Zs and Alphas. I just want to share, Zibo and Maisara, my colleagues sitting out there, they're the young, my team is very young except for me. But basically what we're now doing is training young students on health diplomacy. We have about 8 of them running around Geneva right now. Yeah, but so that these people will be, they are the intergenerational injustice, right, that is going on right now, created by us for the future generation. So they need to be involved. They need to have a seat at the table to say the things to leaders. So I think that's one. The second thing is, how do you radically change education? So, I was sharing with Dermot that when we look at the global level, it can be very depressing when things don't go the way we want, and the geopolitics and so forth. But in my little country, we've been able to really push the government to adopt a national planetary health action plan, to have it in our economic development plan, and from next year, to be in the educational blueprint, which means that every single undergraduate will study planetary health and sustainability. It's a very slow process. And the other thing is, how do we get money to counter? We need to play the same game. But if you are in WHO or you're running an NGO or something, and you ask the donor, can I have some money for communications? They'll say, that's the least priority, right? Do your programming, go and help people. But they don't realize communication actually saves lives. So how do we beat them at the game is to play the same game. And we need to put our heads together to think how we radically raise the money that's required. And the last thing I would say is the economic argument, the co-benefits. We did a research in our place, in our university, to say that the amount of money that is the profit from our fossil fuel industry is not being put into public use, although we think, oh yeah, they build roads and they build schools. No, not really. They give fuel subsidies, right? They pay for fuel subsidies. But the cost to health is far higher than the fuel subsidies that they provide. How do you make that public to say actually, and to the government and policymakers and to the voters, that if you stop or you reduce the fuel subsidies, you actually have health benefits, you have a stronger economic numbers to show, and therefore more to invest in people. That is missing.
Yeah, thank you. So I lied. I'm not going to give you your 1-minute closing quite yet. Shweta came up to remind me that we want to open the floor for questions, and I understand that we have a couple of questions online, and also we'll take questions from the room.
Wonderful. Thank you so much to the panel. There are one quick comment and a quick question. So from Dr. Doris Grinspun, the comment she made is it's important to also discuss issues of racism and systemic inequalities in the context of the placement of fossil fuel infrastructure, often marginalized communities, and this is not accidental. It's often the result of environmental racism and systemic inequalities in zoning, political influence, and land use. Disadvantaged groups frequently have less power to oppose harmful developments and are excluded from decision-making processes that affect their health and environment. So I'm not sure if the panel have any kind of responses or thoughts on that. And then we have another comment, more specifically picking up on the youth. As a Gen Z undergraduate hoping to move into telling the story and standing up to the world's climate and health needs, this was such an eye-opening talk, and I have so many questions. I particularly appreciate Dr. Mahmood speaking about how we need a place on the table, and I wanted to ask for everyone's thoughts on raising a wave of anti-intellectualism that we're seeing in social media circles. People are feeling the need to stand up to academic experts and accusing them of perpetuating elitism, classism, and using elite educational background as a point of criticism. We know this is a broader issue. How can we combat this when it comes to climate and health and communication in general?
And I'll let the panel make a couple of responses to that, and then I'll take a couple of questions from the floor after that. So would somebody like to respond to either of those questions / comments?
It's hard to argue against any of those comments. I mean, there's no argument. You know, there are severe structures of systemic oppression that have a lot to do with why marginalized communities are those most impacted. And this is why, at least as a family physician, to me, it's extremely important to be informed and to inform our membership and people who we're working with about, there's data that supports our claims. Now, I think misinformation in the advocacy on the other direction is also a significant threat, and that we need to really be aware and become aware. And at least I have seen the power of transforming an organization from going from a Wonka even, the planetary health, to now Wonka. This is a big priority. It's not just a small interest group within our organization. It is our organization's priority to be an organization that is thinking about the planet, that creates a family doctor day like last year, where it was related to planetary health and to this kind of work. So I think there's ways that informing our membership, informing clinicians, informing, we didn't talk about children, informing children. I will never forget how my son was in school, and he was the one from kindergarten bringing the information about, Mom, did you realize how bad it is when we're driving our car? I mean, it's just very interesting how little kids are being informed and trained to understand these things in a different light as well.
Since there was a question from the Gen Z and about, the anti-intellectualism, right? So I think we've got to start working with the creative industry. One of the most profound books I read was How Beautiful We Were. I don't know if you've read that, by Imbolo Mbiu, and she's a Nigerian writer. And I was so affected by it because I could see through that book the humanitarian crisis that I had worked in one by one. And I think, how do we use it? No doubt doctors and nurses are trusted, but how do we also use creative industry to do that? I mean, it's even Don't Look Up. I think, it was quite a brave film to make. But the challenge, though, is that people don't have the attention span, and they also have a lot of fear. So what happens is that when there's fear, it's not that they deny that there's a challenge, but because they don't know how to cope with it, so what they do is they keep scrolling their social media and stuff and get distracted by other things. How do you get people to come and refocus again? And I think it has to be in a way that's beautiful, that's storytelling, and also a very strong messages on hope. And I think that someone said to me that climate change itself is a climate denier. In the sense that when you start talking about all the facts on climate change, people just go away further and further. They need to, by human nature, they need to have stories of hope. And on the vulnerability issue, absolutely. Most of the exploration now is going on in, Africa, in parts of Central Asia and so forth, where, the communities are less developed. Indigenous people's rights are taken away, and so forth. So I think this is where the legal profession comes in. We need to work better with, the legal profession, Client Earth and others. And don't forget, that the loss to Shell, the Greenpeace lost a major court battle with Shell. It's going to cost them a lot of money. But how do we now, really, we've got to have new strategies on bringing the legal profession with us as well.
All right, let's take a couple of, do you want to respond as well?
Do you mind?
Yeah, please.
Thank you so much. I would just like to add to this, what we are seeing from some of our works with different organizations, different sectors, and we always like to draw lessons from that, is that us as humans, right, as people, we, taking the action is the fourth step. So there's the ignorance, the denial, the pre-action, and then the action. And so, of course, depending on the audience that we're trying to target and the message we're trying to deliver, we need to do it in a different way. So the narrative needs to change, and the message, and the call to action also changes. So Generation Z, it was very interesting. Just last week in Milan, we discussed sustainable supply chains and sustainable fashion. And when it came to Generation Z and social media, it's very interesting that some of the leading platforms at the moment for reselling clothes, they're actually having educational, informative 18 months long programs with social media influencers, because certain audiences simply decide and trust more people they're following on social media than maybe some other authorities. And that's just how they operate. And if we are to deliver the message, we just need to understand where they'll receive it and how they'll receive it and what do we want them to get out of it and do in the end. So again, I just wanted to add that.
Yeah, and that's, I think a great example of why we in the health community need to be working with creative agencies, but also working with creative agencies that we can trust because they're values aligned, or that we can invite to join us in being values aligned. Let's take a couple questions from the floor. Yasin.
Thanks. Yasin Chalpa, I'm a public health physician from Canada. Maybe a question regarding the expected financial impacts of this. I understand the policy alignment of health organizations not collaborating with a health harming sector, but do we have analysis on how much money the health sector is investing in communications compared to, for instance, the fossil fuel industry, and what that impact would be on the comms industry if they were to fully divest?
I think I am going to answer that question. Okay. And the answer to that question is that you will get a detailed answer in mid-June, because I know that colleagues at Clean Creatives are doing exactly the same analysis. And if, I hope nobody from Clean Creatives is seeing this, but it looks like the health community outweighs this thing. So wait till, but in the guidance document, there's some context in terms of like the health communication market and how exponentially it's growing. So a couple of weeks and you'll have a detailed report coming in.
So we'll take two questions and then get answers from our
Thank
panel,
you.
please.
Anthony Costello from the Lancet Countdown. Just to say thank you for a fantastic meeting. Incredibly important, picking up, the importance of positive messages, the just transition, lots of innovations being supported. However, to energize you, 2 days ago I read a report from the Potsdam Institute, which is just about to come out. And they've looked at all the big 5 climate science models, recasting it because of the acceleration. And they say now, and there's broad unanimity, we'll pass 1.5 degrees this year or next year. 2 degrees by 2037, that's 12 years' time. 3 degrees by 2060. Tomorrow, my first grandchild is 1 month old, so she will be 35 when we pass 3 degrees. And 4 degrees, which is virtual collapse of everything, by 2084. So it's all compressing. So that's the negativity. I only say that to energize us all. I don't think we need to go out and just preach the terrible news. But I think my question is, how do we get a social tipping point? Because that can happen. And I think the younger generation are ready for this. So there are a lot of moves to do this. So I haven't given up. I think, there's the pessimism of the intellect, optimism of the will, as Gramsci said. But, I'm interested to know how we can not just improve things a bit, but really energize the social tipping point. And all this stuff is fantastic.
Yeah, and there was an article in The Guardian about a report that came, or a research that was done that found that 89% of the global population actually wants climate action. So people want this to move forward. So how do we tap into that and make that happen? One more question.
Thank you. I'm Aoife Kirk. I know some of you, most of you in the room. I'm here today on behalf of Irish Doctors for Environment, so I just want to share a bit of a story as to us trying to shift that needle, because a few weeks ago we ran a Ban Fossil Fuels Before It Kills Us campaign, insofar as there's a big billboard now up in Dublin, and we also had a doctor speak at the Parliament on this. I really resonate, Jeremy, with what you're saying around that messaging, and Jemaya as well, around how we need to work together with the creative industry, because when we originally started this campaign, it was far too black and white, and we live in social media land, which is black and white, and as we all know here, working in the health professional, there's so much grey, there's so much nuance. And I think a big learning thing for me is that holier than thou aspect. A lot of the comments that we were seeing on the articles that we were portraying is actually almost exacerbating the left versus right and the woke versus non-woke. So really it's how do we actually bridge those gaps, and maybe it's moving away from the I know best to actually, well, how do we co-curate this together? Because actually none of us really were navigating into very messy waters, as that report has shown.
Yeah, really, really great comment and question. So, panelists, would anyone like to respond to that? To either of these comments?
Yeah, no, I can only agree with what's been said. I think the discussion's been fantastic, and it's mainly about our whole approach to communications around the fossil fuel industry. And I think maybe just to bring it directly back to the pledges and what you're asking effectively of communications agencies, I think the reason I would be very comfortable with this is because it's a proportionate step. It's saying, and it can also be, hopefully will be a positive one, is to say, and I don't know whether the data yet back this up, that you will do better in the long run as a communications agency if you're on this side. It's not, there is, of course, there is money out there from the fossil fuel side, but in terms of the social pressure that will be applied, and if it's true that the healthcare industry actually invests more in communications than fossil fuels, that's, for this specific thing, I think we should apply the kinds of lessons that we've discussed here, and that we can field doctors and nurses who will get behind you if you're on the right side of this transition, and you will hear from trusted voices if you are not. So yeah, I think we should leverage that.
I got very excited with your question on the social tipping points. The very amazing Dr. Courtney, who is your deputy, right?
Our chair of our board of directors, yeah.
Co-chair, right?
Chair.
Chair, okay, she's chair.
Yeah.
So she and I are putting together a Lancet Commission on social tipping points, because I think this is really missing. And one of the things that we as health professionals need to work better is with social scientists. Because knowing the science is one thing, but knowing how to get the science to people is the other. So that's coming, and I maybe put a plug here. The University of Exeter, Tim Lenton and his friends are they put together a Global Tipping Points conference every year. The one that's coming up is June 30th to 3rd of July. So it's going to be talking about all the different types of tipping points. We also need to find health tipping points. No one has done that. I mean, Johan, started us off with the planetary health and now the 16 tipping points. But I think we need to have those social tipping points. What are the health tipping points? What is it, that health tipping points that will really lead to collapse of health systems, for example, right? So I think that's a really fantastic point. But I think, I'm going to be the optimist here because my grandson is 1 year old. And I think the evidence is so clear that nature's ability to bounce back surpasses human abilities. If you haven't watched David Attenborough's latest film, Ocean, I left weeping, when I watched that. And he showed very clearly how nature bounced back, the whales coming back, and the sea kelp growing and so forth. So I think we can win this. I think it's us in this room plus others that will amplify, but we just have very little time. And that window, every time I see Johan, I always call him the master of doom and gloom, because every time he gives me a new piece of data, I'm like, oh, Johan, please tell me something better, right? But he's rightfully very, very worried. But I think we've got to counter that now with a very urgent strategy and bring in lots of people with lots of money behind us to really drive this. We don't have time, right? And We Don't Have Time is a great podcast, by the way. They have a lot of information there as well. So I think it's not impossible to reverse it. This is the thing that people think it's completely irreversible, but I think it can be reversed, but we just have very little time.
Yeah, absolutely. And speaking of having very little time, I hope this is the start of a deeper conversation and an ongoing conversation around this. This is certainly for us the start of this campaign. I want to give each of our wonderful panelists a minute. Let's keep it to a minute to make a last remark, and maybe we'll start where we started with Vivek and end where we ended with initial remarks with Diramed, and go on through the line. So please, your final remark.
Yeah, I think a couple of things that are really, really key to this. And the first is we demand transparency of the fossil fuel industry. I think, so at Influence Map, we only look at publicly available information, and we often describe it like just the tip of the iceberg. We really don't know what's going on there. And as we continue to demand transparency, all these activities are so opaque, that will really help us understand more about how the industry's been successful and what we can actually learn from it. I think the second is that we really present our information and data in a more accessible format. We need to make sure that we're really clear with our messaging, and it's something that resonates with the public. So either, like I mentioned with the fossil fuel industry, they're able to tie any climate action or policy efforts to negative impacts on the public, where in fact these are misleading. We need to be clear with that and fact check these arguments and present them in a format that's accessible to all. And if we can tie these to positive concepts, I think they will resonate with people more. Yeah.
Great, thank you.
Ultimately, I think we need good governance, and at the moment we do have challenges with that, and we also have challenges in fragmentation of law as well. You know, we're all trying to get to the same destination in different ways, and I think those different COPs and different resolutions need to connect. The second thing, invest in young people. I truly believe that if we really put our efforts into getting the young people to lead us, I think we will get further than, you know, old farts like me trying to show the way. I think it's got to be investing in younger people.
Fossil fuel disinformation threatens public health by delaying urgent climate action. Family doctors and primary care clinicians, as trusted messengers and frontline witnesses to health impacts, have a vital role to play in confronting this challenge. And with the right support, with the right information, training, institutional backing, and especially training about advocacy and community, the community of each other, we can speak confidently and effectively for a healthier, fossil-free future. So Wonka, it's on board with this future collaboration, this present and future collaboration. Thank you.
Thank you. From my viewpoint, I would say that it's twofold. One is partnerships, and I believe that each organization, regardless of how they operate in this nexus of climate action and health, need to really look at like who are the people and organizations they're partnering with and that their values align. And the second one is to look at the communications as a vehicle to leverage and deliver. On one side, I really believe that policy advancement is always critical regardless of the sector we're operating in, and on the other side also to deliver the message to the general public and to discuss how do we move different audiences kind of towards a social tipping point. Thank you.
Yeah, thanks. I think, well, also as I got the last word, I think we should be, despite all of the evidence, and as Anthony has just said, it just keeps getting worse, I think we need to end on a message of hope. And I think that is also the message that we should be putting to the communications industry and the advertising industry, that you should be sending a message of hope rather than fear. And because we're all like quoting like grandchildren and citing our grandchildren and so on, and I'll complete the generational story from my side. So my son was sort of energized by the Greta Thunberg the Fridays for Future movement, and spoke at the World Health Assembly a few years ago. He got a little bit quiet on the issue, and I remember being downstairs in the kitchen, and I just got a message saying Tedros will be speaking to young people, scouting movement or something, around climate change. And so I was putting together some talking points when he walked in. I said, I've got this task from Tedros, so what should I write? You're a young person. He immediately turned to me and said, hope. That's what we need. Because all of us know it's terrible, all of us in our generation, so you need to give us some solutions and give us hope. He said, you got that? Write it down. And then he got his sandwich and left.
Wow,
and
fantastic.
I think that's what we should be in the business of selling, and we have the right voices to do it.
Yeah. Well, thank you to our panelists. I want to just close with an invitation and a call to action. We have health organizations that have already made the commitment
to ask their PR and ad agencies to stop supporting fossil fuel disinformation, to stop working with fossil fuel agencies, or they'll move their dollars elsewhere. We invite other health organizations of all kinds from around the world to join this commitment, because we are a powerful community. We have influence, we have moral influence, we have dollars, we have economic influence. So we invite health organizations from around the world of all kinds to join this campaign and join this movement and help us counter the disinformation that is draining hope and instead enable us to carry this message of hope. With that, let's have a round of applause for our panelists. And I'd like to acknowledge Shweta, who is really leading this campaign. And did you want to add any closing remarks? There's coffee. All right. All right. Please join us for some coffee. Thank you, everyone.